service. It has United States and Canada. So when we select this, we have to select properly. It's for Canadian. And we have to do the ECA, Educational Credential Assessment. This is the application sent across the repetitive universities to evaluate the education qualifications. So that we go through the best. Credential assessment is not same for everyone. It will vary from individual to individual and university to university. So before we start this process, review your specific requirement documents according to the university and according to the platform which we choose. Because when we do it in India, if whatever university we studied, the bachelor's or the school in 12th, if we want to go directly, we have to go to the university and submit your documents to ask for a transcript. So before that, we need to create login in the WES, and then they will give you the request form. So we have to take that form to the university to find out and submit your documents, and the university will send directly to the WES in the sealed envelope. We can't able to courier any documents from the university. So they will take our mark sheets, transcripts, whatever applicable for that, and then they directly send it to WES. So this one, I would like to start as an initial process once we are dealing with the English proficiency, because these two will take a longer period to process. So this is very important to start our initial stage. And proof of financial support to the study in masters in Canada. It's not only masters, diploma, or any course. If we want to do it in Canada, they will ask for the proof of fund. So once we started this process, they show all our proof of fund. It will vary from the university. Some institutions might ask us take up the evaluation test to verify the education documents which we submitted. So we have to be very careful and double check all the documents which we are submitting, because they will double verify and they will do cross verification to the places where we worked, where we studied. So this is very important to submit all the documents up to date properly. Even though if we take a break from the after college time, so we have to show them what we are doing in that period. For example, 6 months I took a break and then I want to apply for the master's. In that 6 months, we have to show what we have done in those 6 months. So I did like a small courses in Chennai, or I was doing a volunteer service, or I'm working in the hospital. So we have to make a proof of all those things. So there won't be any gap in between. So it should be a continuous requirements. So next one, please. So when we go for admission information, first of all, we need to find our program. So do some research to find your ideal program information, like prerequisitions. Some colleges has prerequisitions for some courses and grade requirements, etc. If we do the masters, there are two types of, one is course-based master degree, other one is clinical-based master degrees. And second one will be choose your university. Get to know the universities and where they are located, information about the campus visits and residence cost, tuition fee, scholarship, clinical posting, any part-time jobs, and financial support from university or from the government. So how to apply? Each province has their own different regulatory system. Every province has their individual application centers. So first we need to create a login and submit the required information to get the registration. Then choose the program and the university to connect with the university once we receive our ID number for the further communication. So everywhere we have a deadline, so that is very important to collect the documents and plan accordingly to submit before the deadlines. And as I said earlier, for all the provinces, they have like Alberta, British Columbia, Manitoba, New Brunswick, Newfoundland, Nova Scotia, Ontario, Prince Edward Island, and Quebec and Saskatchewan. These are all the provinces available. Most commonly, people would like to go, and safest place people think is Ontario. So when we go to the Ontario, there are two programs. One is colleges and one is universities. Colleges will provide up to diploma, certificate courses, diploma courses, all those things provided by the college. And the master degrees, PhD, higher education, everything provided by the universities. So when we choose go to the college, so I can tell you the information about the colleges for Ontario province, ontariocolleges.ca, international application portal. So this is the website, www.ontariocollege.ca. So this is the one we need to go log into it, sign up, and then follow the steps one by one. If we choose universities to the masters or PhDs, Ontario University's application center is the only one provide every colleges. So we have to go through only one channel, that is this university center. Its website will be www.ouac.on.ca. So if we go through that, they will guide us how to process each and every steps. So everywhere there will be pros and cons. It doesn't matter where we are living, where we are working, we are a student or not. It's all capable. We have to go through these things. So first, I can tell you some advantages which is good when we study in Canada. So once we completed the degree in Canada, so job opening up opportunity is a high value. So we can work while we learn. So we can work like 20 hours a week under the study permit. And international students can apply postgraduate work permit after we completed our degree. So that will be, we have to apply like within 90 days of the course completion. So that will give you irrespective of a province, and there is no any restrictions, we can work anywhere, anytime. And average salary in Canada will be $70,000 per year. So when we take, this will be the good pathway to apply for the permanent residence as well. So when we look into the Canadian average graduation rate, it will be over 70%. When we see the unemployment rate in Canada, it is under 7%. So it clearly shows us we have lots of opportunity to work there once we complete it. The disadvantages are minimal, but it is huge for our cultural things. So the cost of living is very high, and healthcare system is under one control. The system will be under the one in community centers. So when we go for a healthcare, we have to apply for the medical insurance and medical care plans. Those things are very high to apply. So low acceptance rate as international students in the Canadian medical colleges. We all know about this, everywhere it's there. So when we work for our goal, this is nothing. We have to just move away these things and just go for our goal. And tuition fees. But these are all the small disadvantages we have, but we just go and do our work and complete our degree and just get a job and settle there. These are all our own aim to do that. So there are some options. We have to pay one full year fee. So we have to arrange those things. But there is on campus and off campus. When we are in on campus, that will be a very high level of cost. So there will be off campus as well. So we can arrange those things. And there is lots of part-time jobs when we are working. So we can cover our cost of living, some amount from for the tuition fees. So these things we can get rid of burden from our parents and family. Please. Next one, please. Yes. The job opportunities is the second path. So we have two types of things. There will be a private and public, private clinics and public hospitals. The community settings like a home care, hospitals, rehabilitation centers, retirement home, residence care, long-term care facilities, group homes, nursing homes, daycare programs, industries, sports organization, etc. So these are the places we can able to find a job little bit easily, but it's not sure. So we can go through these places to find out our jobs. If you want to find your job, you can go and look into this website, www.cac.gc.ca, job portal. It's a job bank introduced from the Canadian government. So if we have any job offer from this website, it's 200% trustworthy. So we can go for it because it's a registered one from the government. There is no any failure in these things. So as any new physiotherapist intending to work in Canada must obtain a practice with the regulatory colleges in the province where we intend to work. So those we'll see in the next slide, please. Canadian government has announced that top 5 countries out of education outside of Canada is United Kingdom, India, United States, Australia, and Philippines. So we are under the second place. So it shows us like we have a very good educational system here and the knowledge, so it is easy to get a job there. Physiotherapy practice in Canada. If we see the overview of profession in Canada, as I said earlier, the physiotherapy is the regulated profession. So it's all regulated colleges or governed by the council. So each province has their own regulatory college of physiotherapy and each province has regulated under the provincial legislation. So physiotherapists intending to practice in Canada have responsibility to check the licensing requirements, practice standards, code of ethics, continuing competency exams requirements, and disciplines procedures in the province where we intend to practice. So regulatory colleges are responsible for all these 4 parts. So when we have to go through the exams, we have to contact our regulatory colleges where we intend to work, which province. According to that, they will guide us. Next one, please. How to become a physiotherapist in Canada? There are some credentialing and assessments. In Canada, physiotherapy is a regulated profession. We need a license to work as a physiotherapist. The Canadian Alliance of Physiotherapy Regulator, CAPR, is the national body responsible for credentialing evaluation of internationally educated physiotherapists and administers the National Physiotherapy Competence Exam, PCE, for both Canadian educated physiotherapists or internationally educated physiotherapists. So this is the only place we have to process our licensing and credential, and then we are ready to work in Canada. There are few steps we need to go through before we start work. Next slide, please. So the basic steps for licensing physiotherapy will be find out about the licensing requirements in the province or territory where we intend to work. Each province has the regulatory colleges. We already seen about that. Each regulator has their own requirements and should contact the regulators where we plan to work to get the information about the local PT college. Find out potential costs that go through along with the credential and exam process. It's always better to start the credentialing, the process from our hometown to save more money and the time when we arrive in Canada. Because these documents has to be sent directly from the university. So we need to be here to deal with all these things. It's very difficult once we leave the country. Apply for credentialing and submit the documents. Go through carefully, submit all the documents. If it is incomplete, it will make it delay and put us in the trouble. So double check application package and submit correctly. Once we submitted, they will go through all the processes and then they will say we are eligible for the credential, and then we will get a note that we can apply for the PCE exam. So the credentialing will be the first step and the second step will be apply for the exam. So then prepare for your PCE. Once assessment has done, they will send you a letter to inform you are eligible to register for PCE, and the assessment letter provides the details what we have to do next. Once you meet all the requirements, we'll send you the letter confirming that you can apply for PCE. I encourage you to take the language test as soon as possible to prevent your delay, because without the language proficiency test, they are not allowing us to write an exam, and it is one of the eligibility to go for the exam. So we can't register until we successfully completed the language test. If we take IELTS, its minimum score will be 7 for the eligibility. So once you pass, now go back to the regulator. Provincial regulators will not let us know work with the temporary restricted or supervised under the licensed PT. So there are some facilities, restrictions and everywhere. So we have to be informed them that we already passed our exam and they will let us know what to do next. So The PCE exam, if we see about that, there is a two components of the exam. One is written component and second one is clinical component. The written component has 200 questions and we will give a 4 hours time to complete those exams. So there will be a 3 attempts. So we have to film pass in between these 3 attempts. These exams will be done 6 times in a year. So we can register according to that. Now there is little bit changes due to this COVID situation. So when we see this 200 multiple choice questions, there are some categories they divided to choose their questions. So the standard score scale with the mean of 500 and standard deviation of 100. That means the passing score will be 330 on the standard scale. If we look into the categories for questionnaire, there is neuromusculoskeletal. They ask 50% of questions, that is 100 questions from that category. And neurological will be 20%, that is 40 questions. And cardiovascular pulmonary 15%, 30 questions. And multi-system will be 15%, same 30 questions. So all the questions will be 90% of the written questions will be accompanying vignettes, like a scenario basis. The vignettes provides information about the client age, complications, diagnosis, etc. Scenarios of questions that follow are based on the information of the vignette. The remaining 10% will be standalone questions. So when we look into the scenario-based questions, there are like 6 to 10 questions will be follow the same scenario, like same patients. So when we go through that, we may be very confident that first 2 questions which we answered will be the perfect right one. But when we read about the third question, there are some things which won't be accompanied with the first 2. So we have to read very carefully. We need to spend a little more time in each questions when we are going through the scenario based. There is one more options when we do this exam. There is remotely conducted exam, which is introduced right now due to the COVID situation. This physiotherapy competence exam is a practice exam, provides candidates an opportunity to familiarize themselves with the prometric surface assessment platform. They give us a 50 questions and allow us to complete in 1 hour. So this will be the good way to practice ourselves, and the fees is also very less to do this. And right now we have a remoted too, so we can do it from India or anywhere outside Canada. If we are inside Canada, we can do it in a center also, prometric center. It's all computerized exam, so we have an opportunity to go inside the center and do all the process like verification, ID, and seating and everything. So we can do all this process. So when we go for our PC actual exam, we won't be tensed because we already have familiarity to know this, it will be coming up. So this is very good because 200 questions will be a 4 hours. It's 50 questions per hour. We can write many times whenever we want. And if we look into the clinical exam, we have 12 clinical stations. There will be 2 groups, group 1 and group 2. And group 1 and group 2 will be like, group 1 will be 10-minute station and group 2 will be 5-minute station. So the instructor will be there, there will be a patient, so we can assess them and we have to respect the patients and how we are dealing with all the assessments, diagnosis, exercises, treatments, whatever we are doing it, it's all counted in our grades. So this is not applied for right now. So they are closed right now for clinical. So once they reopen after this COVID pandemic, we don't have a practice test for this. But when we go and get a bridging courses, there are opportunity for us to learn more about clinical before we go for the exam. So there are 2 steps we can go through. One is physiotherapy and another one is physiotherapist assistants or physical therapy assistants. This is the one thing we can go and get a job very easily before we get the license. So we can work as a PTA under supervision by the PT until we appear for the examination or receive license. We are not allowed to do assessment and prescribe exercises to plan a treatment. We can teach exercises which already prescribed and gait training and maintenance of equipments, book appointments, and emails and billings. So it's like we have to overall take care of whole clinic, including the front desk job. And we can get clinical experience that will help us in our clinical exams. And we can understand the standards, ethics of physiotherapists and how they are dealing with it, all the rights and laws, which we can do's and don'ts and everything. We can get an experience when we do the clinical postings. Next one, please. So there is last option to enter Canada is a Canada PR for physiotherapists from India. This is one of the pathway. Is it easy as well as a little bit difficulty, huge step to get into it? Because the we could enter inside Canada. This path has a comprehensive ranking system under skilled immigrants through express entry. If we meet all the requirements and reach the score, we will be eligible to apply for PR. The more information will be in this link, www.cac.gc.ca. Once we granted PR, we are eligible to study any course as a resident. So our tuition fee will be 1/3 from the international student fee. So this is very good opportunity. We can work anywhere as a PTA until we get a license or until we prepare for our credential, or we can do any job anywhere without any restrictions. There won't be any contracts under this category. So there are some study groups for PCE exam, online, offline. We'll get more friends and connections, will gain more experience and understand Canadian standard and practice. So it is not same as our practice here. So when we go there, there is lots of restrictions. There are some freedoms. There won't be any questioning from any profession. We have our own profession to do it. So we can assess, we can plan for a treatment. There won't be any interruption from higher level positions. But there are restrictions and laws interrupting our standards in the practice. So we need to know all these things in a deep and hand. Next one, please. So this is one way which I said as a PR, we can do that from anywhere outside Canada if we are not planning to, we are planning to go Canada, but we don't have any other option like a job opportunity, or we are not still we can't able to go for a study due to financial status or anything. This is one of the option for express entry. They just introduced recently like 10 years ago, but still it's eligible to do it. So we need to include like a age, education, work experience, language proficiency, and good character. So there are some age limits to apply for this. According to the score, it will vary. The education degree, as I said earlier, degree transcripts which come in a sealed envelope, consolidated mark sheets from our universities. And work experiences, international work experiences is also included. They will calculate as a score. And if we have a job offer letter from Canada, that is the best one, it will boost up our application and the score as well. And referral letter, any friends or anybody is there, so it's a referral letter will be a good one too. And language proficiency, as I said earlier, IELTS or TOEFL or a Canadian language exam. So for Canada, for PR, immigration, work permit, we have to go general examination for English proficiency. If we need to study, we have to go for a academic one. So when we do the credential for physiotherapy, we have to mention this is for credentialing. So they will directly send the document from the WES to the CAPR. So we need to mention according to that. And good character, we have to do police clearance for this one. So this is one of the options which we can go through it. The website will be same one, but under this category, we can choose the the skilled immigrant. If we get a job opportunity or studying in Canada, we can choose like Canadian experience class. That is one of the easiest way to go through it. So when we get this one, it is very easy. We can land directly and we are eligible to work as a PTA immediately. But there is a bridging courses. It's for a 1 year, but we can go through those courses. They will teach us all the examination requirements, how the questionnaires will be. There will be lots of sample exams, which it will make us practice to go for an exam PCA directly. And then the clinical components also, they will provide us. At the end of those courses, they will post us for a clinical placement. After the graduation, we can probably directly join in the same place to go for a work, which is the best one. We can straight away go working in the same clinic, or we will get lots of connections and friends who can refer us to the different places to start our job. Next one, please. So thank you everyone for your patience. Thanks to Saveetha College and the team for this arranging and wonderful opportunity. I would like to thank my parents, the professors and friends for all the support and guidance. Please reach out to me regarding any questions about the education or job or immigration. I'm very happy to support this. Is there any questions you guys can ask me?
Ma'am, the session was very self-explanatory, and throughout the sessions, we have been receiving many questions. Yes, ma'am, it was very good, and thank you, ma'am. Thank you for the wonderful session. So it was a very self-explanatory session, and the audiences had every doubt being cleared by your session, ma'am.
If they want, they can have a clarification right now.
Yes, ma'am. Sure, we'll be circulating your email ID so that they can contact you, ma'am.
Okay, sure. Thank you so
Sure.
much.
Thank you so much.